Today, we are reacting to the medical scenes and injuries of one of your all-time favorites, Family Guy number 8. And let's dive right in.
I never told you this, but for years now, I've been planning on retiring at 45 so I can work on finding a cure for Alzheimer's disease.
Alzheimer's disease. Alzheimer's disease is not a disease, but I'm assuming it's related to forgetting your testicles.
Peanut, are those testicles? Where did you get those?
I don't remember!
You got Alzheimer's disease, which is a type of dementia. Dementia is basically slowly losing your memory, not able to form new memories. There's multiple different kinds. Oh, he's in the hospital. First glance, these injuries are related to either car accident, a fight, riding a bicycle or a skateboard or a scooter, and he fell and hit his face. Those are kind of the first things that you think of.
Mrs. Griffin, I have some good news or some bad news, depending on how you feel about your husband. Do you love your husband?
Yes.
Mrs. Griffin, I have some bad news. Your husband is brain dead.
We don't present things this way. You don't say good news, bad news. You just say this is what we found.
I'm afraid it's time for you to make your choice.
Make your choice.
Are you telling me I should pull the plug?
I'm afraid so.
Typically, if there's no brain function, then you actually wouldn't have the function to breathe. So you should probably be on a ventilator. Pulling the plug basically means turning off the mechanical ventilation. If their brain isn't functioning to tell them to breathe, they will die pretty quickly right after that.
Also, you might be getting a call about the service you received here today. Do you feel I've earned all 10s?
We, as physicians, are judged by the government based on surveys that patients do. It's called a Prascani score in the emergency department. Do we address all the concerns? Did we address your pain? Basically, just hits the things that we should do.
I don't want to go! Hey,
Hey,
that's a plug. You pulled the plug on me?
Oh, what? Oh, man, Lois. Actually, sometimes things like this happen. Usually, it's from GHB, the drug which people become totally unconscious, and then once it's metabolized out of their system, they just all of a sudden wake up. They rip their endotracheal tubes out.
Peanut, it was a very difficult decision.
How could you do that? I'm alive!
I'm here from the mortgage company. Mr. Griffin, you're 3 months late on your payment.
So that is a tough conversation to have. That flatline noise that you hear in movies is most of the time just a fake idea. You hear the bloop, bloop, bloop. We don't hear those at the hospital either. It would just be a ton of different noises all over the place. He's got a pulse ox monitor on his fingers, and he's got an IV in his right arm in the antecubital fossa, so good job. At the hospital, obviously. Lois, you're freaking out.
Don't worry, Lois. I went blind a while back.
Oh.
It was cool.
Dr. Hartman, you said there was very little risk to Lasik, but now I am blind.
So Lois is blind after eye surgery. Sometimes you can have a lot of edema and swelling to the eye itself. So that can cause temporary blindness. At that point, anytime there's blindness, phone call to an ophthalmologist, potentially get a CT scan of the head to make sure that there's no mass or no injuries. And then the ophthalmologist needs to see these patients.
Okay, look, this isn't my fault. It was take your cat to work day.
I love that the laser the cat was using to run around and try to get. So you wouldn't do it freehand like that. Animals in the hospital, yeah, that doesn't happen. We do have in certain hospitals therapy dogs, but not a random bring your animal to work day.
Get that cat out of here.
They're not sterile, they're dirty.
And until she gets used to her new life, you'll need to take care of her. Feed her, bathe her, drive her places.
They're gone, aren't they?
They left, yes.
Wow. There are times when we see family dump their member into the emergency department and we can't contact them, and then we have to figure out what to do with these individuals, and then that's when you actually get law enforcement involved.
Sorry to keep you. I was reading this Highlights magazine in the waiting room.
Oh my gosh, I remember those Highlight magazines. We got some little baby x-rays up there. We got a sternal notch all the way down to the pelvis.
Dr. Hartman, were you able to tell anything from Stewie's x-rays?
Oh, yeah. Little guy's got scoliosis.
Oh, my God.
Scoliosis is basically lateral angulation of the spine. You can actually just do an exam where you put your feet together, you bend forward. The ribs basically will then rotate one way or the other. So that is one way to do a quick assessment for scoliosis.
Oh, no. Am I going to be a big shoe, small shoe guy?
This doesn't typically have to do with leg length discrepancies. It could a little bit if you're having pelvic shifting. You need to build up a shoe. A big difference versus like, do you need a little lift in your shoe? Those sorts of things.
But don't worry, he'll be fine. He just needs to wear this brace for a while to correct it.
Oh, dear.
Now, does he have any school pictures coming up?
Yeah, he actually does.
Well, then this will not be a refrigerator door year.
The braces that we use at the hospital that I see are something called a TLSO brace, and it has to do with the different areas of your spine. Typically, it's used when there's like a fracture versus misalignment.
What the deuce?
Uh-oh.
Ryan!
Yeah! Oh my, what? He has such a massive head that the sound of his head hitting the stairs is actually a really good job.
It's got to be from wearing that damn brace all the time. Your neck must have atrophied so much it can no longer support your head.
There you go. We do tell people with the soft cervical collars not to put those on because you can actually cause muscle stiffness and potential atrophy. Say you have a shoulder sling. You got to make sure you take it out of there and do gentle movements. If you use it all the time, you can actually cause yourself frozen shoulder syndrome.
You've got to take me to the hospital. Absolutely. Let me just watch Jennifer's body and we'll go right there.
If you have neck laxity or you injure your neck, make sure you stabilize it. Wrap a towel at your house and roll it up and put it into almost like a horseshoe and put it in that area. You can tape the front. What the heck? What the heck?
God,
Having a heart attack?
Chris is having a heart attack.
We're not supposed to leave the table.
Chris is having a heart attack. Isn't Chris like a kid? It's not impossible to have a heart attack at a young age. Typically, it's due to like a congenital issue. More commonly, it's like 40s, 50s, and 60s is when bad cardiovascular disease starts kicking in.
You almost worked yourself right into the ground, buddy.
Oh, it's all our fault. We never should have let you take on the pressure of being an adult.
It's okay, Mom. Boy, I thought being a grown-up would be easier than being a kid. But it turned out it was just as hard.
Heart attack, in general, is defined as a ruptured plaque that causes a blockage and the heart can stop or go into a cardiac arrhythmia. If he doesn't have plaque development, he shouldn't be having a heart attack, but you can actually have something that has to do with broken heart syndrome, which could present as a heart attack.
I guess what we all learned is that no matter who you are or where you come from, life is a terrible thing.
No, it's not. Life is what you make of it. But on the flip side, stress is a real thing, and it really does affect our bodies and our mental state and physical state.
All right, we're just going to take a quick cap smear.
Don't you
Pap
mean
smear?
pap smear?
No, at this hospital, we obtained the sample using beloved British comic strip roustabout Andy Capp.
Oh my gosh. I've never seen this or heard this episode. What the heck?
Hello, love. Let's have a smear.
What? Anybody having this type of exam will tell you it is awful. They're both male, so nowadays you actually have a female chaperone in the room.
I'm not letting you do that. You can't even see.
That's all right, bird. I goes by smell.
The emergency department has a plethora of abnormal smells. This schnoz right here has the ability to pick up a lot of different smells. The smell of marijuana or the smell of regular alcohol versus metabolized alcohol. We have the ability to just like pick up these smells just because we're around them so often. Holy cow. Family Guy just never gets old. I like this show. I like the medical scenes that it has. If you guys like this episode, check out this playlist and binge watch every Family Guy react that I've done. And as always, please make sure you subscribe, turn those bell notifications on. Thank you so much for watching and stay healthy, my friends.